such as diabetes, cardiovascular disease, metabolic disease. How could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. A federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. But I don't want to make this too much about money. It's the human tragedy. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, or a Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that, but you should know what the impacts are on your family and on your health.
Questions. I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy. All of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts?
He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right. So
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
Let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
Mr. Kennedy, the facts. The facts.
The committee will be in order.
The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move on.
Senator, I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Welcome. I'm going to do